And I need to cleanse you too, so I assume that's...
Hi, I'm Dr. Kristen Jacobs from Ooh La La Spa, Anti-Aging and Wellness, and we are live on Instagram and live on Facebook. So super excited to be here. We were going to do old therapy today. So for those of you, which I know a lot of you tuned in just to see the old therapy, we're going to hold off. And the reason why we're holding off is because we just found out there's actually some great advanced training, and we always try to do our training anyway, so this is all new. So we thought, well, let's do our training first, and then we'll do the old therapy again. It's only been, I think, 6 or 7 months since I've had my old therapy anyway, and so I can hold off a little bit longer because we usually recommend doing that every year. And old therapy is an amazing treatment that stimulates collagen. So I don't want to miss out on it, and I will not. We're just going to postpone that. So instead today, we're going to do, we're actually going to do Diamond Glow, which I haven't had a Diamond Glow in a long time, and I absolutely love Diamond Glow. If you've not tried one of these, you really need to try it. It is a treatment that exfoliates, infuses hydration, or if you have acne issues, it'll help to treat that. What else does it do, Jill? Vitamin C, extractions, yeah.
And so, we get to pick our serum.
And we get to pick our serum, and that's one of the reasons why I want to do the Diamond Glow today, because the new TNS A+ serum just came out. So I haven't even used it yet, and this will be the first time, but we're going to talk about that, and we're going to talk about the TNS A+ serum you should be using every single day. But right now, Jill is going to wash my face. And this is one of the best parts of the whole treatment because it's so relaxing.
And this treatment is face and neck, so everybody always likes that they get the neck with this one as well. It's a huge added benefit.
And doing this one time, you will see nice change. You'll see hydration in your skin. You'll see plumping of the fine lines and wrinkles. But really, this treatment is meant to do in series. And actually, doing monthly is the best way to see the best results with it. So the makers of Skinmedica now formulate all of the serums as well. So we have some science to back up this treatment, and we see great results because we know we're actually using ingredients that will change the skin. So like I said, that's why we're doing the TNS A+ one today. It is based off the TNS A+ serum that you use daily, and we really should see some nice change in my skin immediately, but it'll also continue to improve over the next several days. So again, this treatment is called Diamond Glow. You get full face, you get neck. She's going to concentrate around the eyes and actually on the mouth too, the lips. And so you're able to see change everywhere. So it's going to improve dark circles. It's going to help with the fine lines and wrinkles. I've said that a million times, but that's really all that I want to go away. And it's not necessarily going to stimulate collagen per se by doing one treatment. But again, taking care of your skin, having healthy skin is going to help the whole overall picture of your skin. So, let's see, we have vitamin C, we have hydrating, we have pore clarifying,
Skin
brightening. So if you have any brown spots, we can use our serum to help with that.
So go ahead and tip your head back and a little bit to left. So we're going to start on the neck area. The diamond, you can see the diamond tip in the center here. So that's going to give her a really nice exfoliation. And you can hear the suction. So as I move the tip down her neck, she's getting exfoliation and extraction and infusion all at the same time.
Which is really cool that you're getting all of this at the same time instead of doing one step, then the next step, and then the next step. So I think it's a pretty nifty little machine.
A lot of people are familiar with microderm, and this is really taking microderm to the next level.
Right, because microderm is really just doing the exfoliation, which is great, you know, because you want to get rid of all those dead skin cells, but why not, if you're going to be on the table, why not go ahead and do the other two things, which are extractions and infuse. And so it feels like, I mean, really just feels like she's pulling on my skin a little bit. It's definitely not painful at all. I did have a hard time talking. She was going down the neck, but it feels good. And it's, you know, a little bit wet because of hydration, but it's not overly wet by any means. And I mentioned the pore clarifying. We're really seeing great results with acne-prone patients. So not just our perimenopausal women who for some unknown reason are having acne issues, but we see great results with our teenage patients. So nice and easy, nice relaxing. And as I said, you should do this monthly. Now, if you're doing it for acne treatment, you can actually do every other week. So every 2 weeks, do a treatment to help clear it up. And then your at-home products, your TNS A+ serum that's our newest collagen stimulating serum. Steph, are you showing that one? If you don't mind. Oh, there you go. So this product just came out a few weeks ago, and for those of you who use our TNS Essentials Serum, this is the upgraded version basically. Even though I say it's upgraded, it's actually a brand new product. All different ingredients. The growth factors are still created from the original cells, but it's grown at in a different environment, so therefore there are a lot more growth factors in this product, and that's going to stimulate the collagen. So as we age, we tend to lose collagen, and that starts as early as our late 20s, early 30s, and then by the time we're in our 50s, we're really not producing any collagen, and our body's breaking it down. So if there's one thing that you need to be doing, even at an early age, you need to be stimulating that collagen on a daily basis. We have a lot of in-office treatments that stimulate collagen, so you want to do that as well, and that's the old therapy I was talking about earlier. But you really need to be doing this on a daily basis so that you can maintain your the skin, and it's going to help with any sagging skin, or maintain your skin so that it does not sag. And that is what I am always looking for. I do not want sagging skin. And sometimes, you know, you have to do a few other things like add a little filler. I mean, the bottom line with doing aesthetics is that you're not really a one and done kind of treatment. You really have to do combinations of treatment. So Diamond Glow that I'm doing right now is an excellent treatment to do on a monthly basis to help to maintain the health of the skin. Your products that you do at home also are going to help to maintain the health of the skin, and think of it as your treatment at home. And then your other in-house treatments that you need to do, they're just based on what your goals and needs are as to when you would do them. So I mentioned earlier that I'm going to do a second treatment today. I'm doing Secret RF after this, which I did this a month ago on live, so I'm not going to do it on live today. However, Steph will be taking little video snippets and taking some photos and all that, so you can see that too. But the Secret RF uses radio frequency to help stimulate collagen. So for me, I try to hit my collagen stimulation every which way I possibly can. And then the Diamond Glow, as I said, I have not been doing it monthly, but I plan to start doing it monthly because I just feel like it's such an essential part to your overall health of the skin and the anti-aging process.
Turn a little more.
So like I said, so we do a lot of combo treatments in here, and what we like to do is have you come in and we sit down with you, we take photos, we look at the underneath surface of your skin to see how much damage there is basically, and then we talk about all the different ways to help offset that damage, to do some treating, to do some delay of aging. So we talk about correcting, preventing, and then protecting the skin.
Sorry.
That's all right. So then we get you on, we create a treatment plan, and we get you on, monthly, every quarterly, every 6 months, kind of coming and doing treatments. And then the beauty of coming in here with, once we create this treatment plan for you, is we can actually create a treatment budget for you as well. So one of our most popular memberships that we have is our Diamond Glow membership. And we really, because we're coming in monthly for it, we actually give you a pretty good discount on that monthly treatment. I had a gal and she was technically she was doing Hydrofacial first. She's now switched to Diamond Glow since we switched to our Diamond Glow. But all she was doing was a Hydrofacial every month, which is very similar to Diamond Glow, just not as, doesn't infuse as much. It really doesn't, it doesn't really extract as much. It's a deeper, Diamond Glow is a deeper version of Hydrofacial, in my opinion. But anyway, so she was doing that monthly. She was doing a little bit of Botox, and her skin age changed, I want to say 5 or 6 years, just by doing that maintenance of the Hydrofacial / Diamond Glow. And she said, I asked her yesterday after she was in, and I asked her what she thought the difference with the Hydrofacial and Diamond Glow. And she said she could see a difference in a couple of days with the Diamond Glow, which really Hydrofacial was more of just a, hey, I have it done, I'm done, and the skin looks good right after. But she could continue to see the results of the Diamond Glow, and she said she liked it better. She feels like she gets a better treatment with it. What else do you have to add, Jill?
Did you talk about acne patients? So for acne patients, we like to combine this one with laser genesis. Laser genesis kills the bacteria, and we use our pore clarifying solution, so we get, it cleans the pores out, so it's going to exfoliate, extract the pores, and infuse the pore clarifying solution all at the same time. So combining that with a laser treatment is great for our acne prone patients, and we're seeing a lot of that right now with people having to wear masks. This service is awesome in the membership. So in our Fountain Club membership, when you opt to do it that direction monthly, you do get a savings, which is awesome. And it's crazy how quickly you can see the change in the skin when you combine something like this with the products as well.
And I mentioned the TNS Plus serum, but if you are having the mask knee is what we're calling it, because everybody is having acne with their masks, some of the products that you could combine with this treatment would be our retinol product. And retinol is great for anti-aging, but it helps to dry up the acne as well. And then our Aha Baha cleanser would be another product that I would recommend for patients with acne, or again with the having issues because of the masks. And that one's going to exfoliate the skin 2 to 3 times a week, which is great. And it's how do you describe the Aha Baha cleanser?
It's an alpha beta hydroxy acid, and it's got spherical beads in it. So whenever you massage it onto your skin when you're cleansing, you can feel the beads, and you can feel it doing something. I love that. You can feel it doing something. So a lot of times I'll recommend use your retinol at night. That helps break up the dead skin cells, and then use your Aha Baha cleanser in the morning, and it works like a vacuum. It's going to take that off. So the two work really well together.
And you use the Aha Baha cleanser.
I do. I actually use the Aha Baha cleanser, and I cannot live without the retinol either. Okay, so I'm switching to a smooth tip, and we are going to use that on her eyes and her mouth.
You can customize the tips for your skin type, correct?
Correct, yes. So I used the normal tip on her today. Dr. Jacobs has sensitive skin, so you can see she's a little bit pink. The amount of redness she has is pretty normal. Most people will only have this for a few hours post-treatment, and then your skin will just be glowing and look back to normal again.
I mean, I might be making it up, but I feel like my skin feels tighter already. I mean, I really feel like it feels different. It feels good.
She used this the Tns Essentials.
I wonder, since it's the first time I'm using it, I wonder if I'll be able to tell much of a difference. I mean, I usually use the hydrating one because I'm so sensitive and so dry, and I can definitely tell a difference with the hydration, but I wonder if maybe that's why I'm feeling a little bit tighter with the TNS Plus. I just love that product, and I've already, I don't know how many bottles I've gone through already, but I feel like I can really tell a difference with my skin. And for me, when I'm talking about treatment plans, my treatment plan includes Botox every 3 months. I do not miss that. I love it, and could not go without that. I touch up my forehead with Botox every probably 6 to 8 weeks because I just do a little at a time. And then my new plan is going to be to do Diamond Glow monthly. And I do the old therapy at least annually. Sometimes the last 2 years I've been doing it every 6 months. So I feel like that has helped maintain my skin so much, and I have not had filler in, it's almost 4 years. I think it's like 3 3/4. I feel like I could probably use a little bit of filler and a little bit in my lips, but I don't look in the mirror and go, oh man, I really need filler. So that's where the collagen stimulates the old therapy really, again, maintains. And then, gosh, what else do I do? I'm doing The Secret, and I'm on treatment 2 of a 3 series, and I'll do that quarterly. And that is for the collagen stimulation and the texture, pore size, any kind of brown spots, which luckily I don't really have the brown spots that are visible. Hopefully they don't come out because I try to treat them, but you can definitely see them underneath the surface of the damage of the skin. Is that it, Jill? Well, I do Thermiva as well. Thermiva is different. It's collagen stimulation, and that I did, what, do we do a series of 3?
Series of 3 a month apart, and then after that, we either treat every 6 months or annually, depending on basically how the person's doing post-treatment.
Yeah, and I had my 6-month treatment, gosh, with this COVID, I don't even know what month it is, day it is half the time. I had a treatment and I've been doing great, and that's to help to combat like urinary incontinence, with coughing or sneezing or running in my case sometimes, but knock on wood, I've really, the little maintenance treatment, I've been doing really well. That's really, I think that's really all I do. And a lot of product, you know.
So next I'm going to go to our lips. This is my favorite part of this procedure because our lips just don't ever get a really good exfoliation. And this is going to take off that top layer of dead skin. It's going to help exfoliate it really well. When we're done, they will look nice and plump from the vacuum suction. In fact, I'm going to do the right side, and then if you want to, Steph, you can zoom in before I do the left side. You doing okay? Is that too much vacuum or are you
Not
okay?
at all.
Okay. Yeah, you can see how she's nice and plump.
It's the only way to shut me up is to do
Yeah. Yeah, let me talk for a minute, right? Okay.
We need the behind the scenes of Stephanie.
So I've done the right side, nice and plump on the right side, and you can see how they just look more pink and hydrated. So we're going to get the top layer of dead skin off the left side and hydrate her really good over here on the left side.
Thank you.
Okay, let me put a little more on and then lips will be done.
Bless you. It's like, oh,
I'm going to go over your forehead again, just use up the rest of the serum.
Sounds good. Yeah, you probably, I mean, I didn't feel like the suction was too much at all, so I'm excited to see them. I think this is a good kind of a trial if you wanted filler of what your lips would look like, because we do such subtle lips, you know, that we don't want anybody knowing you had your lips done. So I think this would be a good way to see what your lips would look like. Just a little extra plump, a little hydration. So I think we have 5 Diamond Glow rebates that were just added to our account today. So if anybody is interested in doing a series of Diamond Glows, I think we are doing like some free products with it. And as I said, we only have 5 of these, so if you have any interest in I think you have to buy 3 to get the free product is how it's working, but Steph will get the details in the message. But we only have 5 of them, so give us a call if you're interested and we can get you hooked up with that. So is that it then? See, I'm always so sad when it's over because see, this is why I had to do it every month, but I'm always so sad because I'm like, oh, I want more. So if you have any questions, the treatment I did today was Diamond Glow, and I'm sure I look glowy. And if you want to know more about it, give us a call at 618-288-9117. Thanks for watching.